Dr. zur Linden is a researcher at the Ontario Veterinary College and has been working on some pretty interesting 3D printing. He's going to tell us a bit about how it is done and what the applications are. So tell us a bit about what you're working on, creating anatomical models of the equine neck, and how veterinary students will be using these models to practice a common method of treating osteoarthritis.
Sure. This project actually started a few years ago when I started working with a design engineer on campus. His name is John Phillips in the College of Arts. He actually helped me to construct a model of a canine urinary bladder to help me develop an ultrasound guided procedure in dog urinary bladders. I'm a radiologist at the Ontario Veterinary College, so I work with all sorts of animals, exotics, cats, dogs, horses, and farm animals. So this initial model was actually for dogs at the time. This design engineer uses 3D printing actually. It's not the only method he has available to him. Being in the College of Arts, he helps design a whole bunch of different things. But for model design, he's very useful for helping me sort of from the creative side, as well as actually constructing things from the physical side of things. So a while ago, I had this idea that we might be able to actually help teach people, so people like our veterinary students, interns and residents in the clinic, as well as veterinarians that have already graduated from the university and are working with horses or other animals that may be able to use some of these models in the future in their practice. The goal was to see if we could teach them how to perform certain procedures that are challenging, that they weren't taught in vet school, but can actually be learned with appropriate training and especially practice on a model before actually using it on a clinical patient. So I teamed up with John again, and we postulated that we might be able to actually replicate the skeletal anatomy of a horse with 3D printing. So we'd make the spine or whatever anatomy we wanted to look at, make that out of plastic. And then we could actually embed those bones or that plastic bone in ballistics gel, which will actually mimic soft tissues like the muscles and the fat, etc., that surround the skeleton, mimic those tissues on ultrasound. Ballistics gel you may have seen in something like Mythbusters or Forged in Fire, where they use this gel to mimic, say, a person's torso or something like that. It's sort of a yellowish, semi-opaque material that they use on these shows, but the ballistics gel I'm using is actually perfectly clear, so you can see into the model, which is very helpful for directing, for giving you direct feedback. So the goal would be to use ultrasound to guide, say, a needle into a joint or something like that, and then your direct feedback is actually then looking at the model and looking through that clear ballistics gel and making sure your needle is exactly where it's supposed to be. So we thought that was going to be a useful tool for people to do. Now horses are a little bit challenging in that regard because horses are so big compared to, say, a dog or a cat. But we did find, and I'll talk about that in a second, we did find, or I came up with 3 different models that may actually be useful to train people how to perform ultrasound guided injections. And these are things that are typically done in our hospital for horses that for the most part develop osteoarthritis. And this is in the neck, the hip, and the sacroiliac joint, which is in the back end. These are 3 common areas that require ultrasound guidance. There are a lot of other joints, joints of the feet that you can inject, but you don't necessarily need ultrasound guidance for this, so we didn't focus on that. We were just focusing on the procedures that at OVC anyways, radiologists would help the clinicians perform. So really these models are all about the procedure of actually injecting something into the joint to help improve the joint. Now, whether that's a diagnostic sample, you're injecting a local anesthetic into the joint for diagnosis, or you're actually injecting something that's supposed to help the joint over time, whether that's steroids, hyaluronic acid, protein-rich plasma, stem cells, or some other novel therapy that's yet to be tried in the horse joint yet. It doesn't really matter what you're injecting with respect to these models anyways. We're just practicing the procedure of placing the needles into these joints. So our first model that we actually wanted to create was the model of the horse neck. We thought this would probably be the most challenging because the horse's neck is the largest part of the anatomy out of all three areas that we wanted to create a model for. My goal was to put the model, this giant model, if we could create one, as well as other smaller training models into a clinical skills laboratory for veterinary students to use throughout their education. So we have this lab available at the Ontario Veterinary College. I also wanted to use these to train residents so they could help perform these procedures in the clinic prior to using them in clinical patients, and eventually reach out to practitioners that want to learn how to perform these procedures and then teach them how to perform them. So that's sort of our goal at the start of this project.
Great. And how will the use of a model compare to the current training method where they are using cadavers to practice intra-articular joint injections?
Sure. So there are cadavers. I'd say there are sort of two current methods of training ultrasound-guided joint injections. One is using live clinical patients that require these injections. And then the other one, like you said, would be using cadavers. Now, it's often not ideal, as you can imagine, that you to allow novices to practice these procedures on live clinical animals. And this is only typically done with residents, so they've already had an internship and they have ultrasound experience, and it's only done under direct faculty supervision. So it's a very limited amount of time that even our residents get, but this currently is our current practice. Obviously, the size of the patient is challenging to work with, but you also can't see into the patient, so there's no direct feedback. And the best way to learn something is to get direct feedback of when you've done something. So if you place a needle into a joint with ultrasound, you either have somebody over your shoulder that says, yes, that looks good, or what's typically done is you inject a dye, like a bright blue, methylene blue dye into the joint. And then you do this, at multiple spots along the spine to practice. And you have both left and right sides of the neck to practice this. But then in order to get your feedback of whether or not you were successful, you have to dissect down to that joint, cut open the joint, and see where exactly the dye went. Was it in the joint, or was it around the joint, or were you way off? And so there's a time lapse of at least probably 30 to 60 minutes, maybe more, from when you actually place the needle to when you get that direct feedback. And so there's a huge learning gap there. Also, when you're working with cadavers, you can only, really have maybe 2 to 4 people at a time that are going to get any beneficial learning from that one cadaver. And so it's really challenging, I guess. And so having this model will really help people. They can spend more time. There's no tissues decomposing. These models don't decompose. They're made of synthetic materials. They're not going to go moldy. They're going to last for a long time. You can spend hours and hours until you're comfortable before actually moving on to a clinical patient. And the models we're making with the ballistics gel, you can actually remelt the ballistics gel. So I guess the issue is when you use the model and you pass a needle into it, you'll get these tracks that show up. And you can only really use the model maybe 5 to 10 times per joint, and there's multiple joints in the horse's neck. 5 to 10 times per joint before you really need to melt it down again. And you just have to put the model into an oven, remelt it for about half an hour, and that'll get rid of the needle tracks, and then you're basically back to a brand new model, and can keep going. And I'm not sure how long we can keep going, because I haven't reached a time limit yet of how many times we can remelt our models yet.
How long have you been working with 3D printing, and how has the technology evolved?
Yeah, I've probably been working with it since about 2015. I think that's when I first reached out to John Phillips, our design engineer, and we started working on our first project, and we've sort of been working with each other on various projects throughout the years. I'm not sure I've really noticed the technology evolve, I guess, per se. Maybe a little bit. We've just been able to access a wider range of different printing technologies and materials. Some people out there, I'm sure, know a little bit about 3D printing, but once you start diving into it in detail, there's actually a whole bunch of different printers out there, so different technologies you can use, as well as different plastics you can print in, and those give you different types of models that you can use. And so since we've been diving into it for the last few years, we've actually opened up a few doors for us, and we've been able to access a lot of different printers. And so we've seen a lot of different technologies out there and what might be useful for a certain teaching model or a clinical training model or something we might need for a research project or something like that. We did start a working group at OVC with our work in dogs. We call that group RAPID, or Rapid Prototyping of Patient-Specific Implants for Dogs. And that was mainly for skull plates and things like that, for tumors on the skull of dogs, as well as other potential implants that we could create. Now, those implants are made out of metal. They're not 3D printed out of plastic. So there's a lot of work and research still to do in various fields, and it doesn't necessarily depend on the type of animal, if it's a horse or a dog. This group we're also trying to launch a consortium of 3D printing in veterinary medicine to act as sort of a resource for others that would like to get into this field. And hopefully that'll be happening in the next few months. Because when most universities try to get into 3D printing, they'll basically start everything from scratch and learn from the bottom up. And we're hoping to sort of collaborate with everybody in North America and see if we can get our resources together in one spot and sort of help each other out to help our patients out, basically.
I was reading your paper working on the cervical vertebrae and of the equine, and I was surprised to see how many printers were involved in the research. Can you talk us through the process of creating one of these models, some of the steps, and how long it takes?
So that project was vital because when we started, we had this idea we wanted to create this model and embed it in ballistics gel. But when we started, we were like, okay, well, what are we going to print with? And we looked in the literature in a lot of human papers, and they just basically chose a random whatever 3D printing material they had on hand and then used it, and then it worked well. So they didn't really test a lot of materials. They just started using it, and they showed that their model was good for that specific problem, basically. So we wanted to find, because our project was directed to ultrasound guided procedures, so we wanted to make sure that our models looked like bone and a real patient would look like, but with plastic. So we wanted to test as many different types of plastics and technologies that we could get our hands on. And we ended up with 13 different types of plastic from, I think it was 11 different technologies. So we ended up with 13 actual models that were used and tested in our study. It was actually very useful to help us moving forward anyways. So how we create these models, basically they start from a CT scan or CAT scan of either a patient, or we could scan a cadaver as well. We then take that CT scan and put it into various different types of software. Now, this is what my design engineer does. I've tried this a little bit in some software programs, but he's really good at it and can do it quite quickly. You can then segment out the anatomy you want. So say we scan a whole entire horse neck. We can actually segment out and just print one actual joint to create either just a small model if we wanted to, or we could segment out and just take all the bones out of that, get rid of all the soft tissues, just so we can print that entire neck. Now, I do have an image of the horse's, the entire neck of a horse that we printed, and this is actually the left side of the horse's neck. And you can see there's a bunch of holes everywhere. These are actually for attaching the model to a plate that we will eventually do, and it's actually only half of the neck. So we're going to have two models that can then be close to each other. One is the left side of the neck and one is the right side of the neck. But all of these adaptations to our model were done in digitally before they were printed. And so this actually takes the longest amount of time. I'd say on the order of weeks. Well, obviously multiple hours, but would probably take weeks to get everything organized and done properly and appropriately. The 3D printing itself is actually the easiest part for the most. Now, we tested 13 different types of models, but we didn't actually have access to all of these models. So we printed maybe half of them, but then we could actually order the other half. So there's a lot of companies out there that you can order 3D printed models from, and they will ship them to you already printed. And so we did that for a few of them, just so we could expand the amount of models that we were trying to get, or the amount of materials that we were trying to get. So 3D printing, say just one joint would probably take maybe 2 to 4 hours, depending on the printer that was used. Sometimes a little bit longer, maybe 6 hours. But again, compared to the amount of time and hours that it would take to make the digital file, it's quite a lot longer. So once we print your model, there's some post-processing involved depending on the method that you use to print. Post-processing just means that it's done after, it's part of the processing aspect of it, but it's done after the printing. So sometimes there's supports that are put on the model during the printing, and those supports have to be removed. Some technologies are easier to remove the supports than others, and some technologies don't have supports, so it just sort of depends. But there's probably at least an hour or two of post-processing in there, as well as, the 3D printer that I just purchased has a curing stage, like most of the technologies do, where you embed them in either, for this specific printer, you embed them in ethanol. Embed them in ethanol to remove some of the excess resin, and then you actually put them under UV light for UV or violet light for about an hour to finish curing them. So that takes a couple extra hours for the post-processing part. And then you basically have your 3D printed skeleton. Then I have a smaller model, and this is what we printed. So this is just one actual joint of the cervical spine. And it's placed in a tin. So we have little screws that went through the model and attached it to a metal tin. And in this tin, you actually have clear ballistics gel. So the clear ballistics gel comes in giant blocks, and we cut it up, throw it in the tin, and then melt it, and you get this nice clear, eventually you get a nice clear model. Some of the issues with working with ballistics gel is that you get a lot of gas coming off of your models as you melt them. So you get a lot of gas bubbles in your model, and the goal is to make a clear model. So we actually have to do this under a vacuum, and we suck all the gas out of the model, and then we're left, as this picture shows, a nice clear ballistics gel where you can actually see your joint for your direct feedback when learning these procedures. So these two models that I've showed you, in the end, this is actually what we're going to use to try and teach our students and other people. The small model itself is very, very good just for learning how to manipulate the ultrasound probe and get the needle in the right spot. And then the larger model is going to be, the next step between the smaller model and going on to a live clinical horse, because you have this whole skeleton, and it's going to be quite a large model in the end. I don't have the exact dimensions right now, as the model's in the lab right now, but it's going to be quite large. The challenge with the larger model is going to be the remelting of it. So the smaller models that are in these tiny tins are actually going to be very easy to to remelt and can be done on a daily basis for the students to allow the students to practice over and over again. The larger model is going to be a little bit more challenging, and we're still actually working out some of the details in the research project to try and do this efficiently and make it so that we can actually remelt them without too much, without being too big of a process, I guess.
Amazing. So how important has the funding from Equine Guelph been to this research?
Yeah, it's been huge. It's been vital to perform, especially this specific research project, but as well as learning how to create these models for, moving forward for other projects, for horses, for dogs, for, it's all a big learning curve for us right now. And we've got a lot of research backing up a lot of this, but we're also doing a lot of research at the same time to make sure that we're using the right materials and things like that. So like you already said, this funding did allow us to research the best 3D printing materials and technologies that would mimic bone using ultrasound. So hopefully this will has given, I think we published the paper last year in 2019, given the scientific community at least a resource if they do want to produce similar models to be used for ultrasound guidance, because what's out there wasn't as in-depth as what we went into. And then these models are also the first of their kind in the veterinary field, and so I'm hoping that they can be used successfully to teach our students and the next generation of students and help them get ready for their real-world practice, and sort of can help add an extra tool into their practice that hasn't up to this date been taught to them.
Thanks for sharing your expertise. In closing, is there anything you'd like to add or give us a peek into the future?
There's one great thing about these models, that it's based on CT scans of real patients. So they can be scanned just once, and then we can replicate the anatomy. We can replicate the models many times to give our students normal anatomy. But we can also use clinical patient scans, so the patients don't have to be cadavers. They can be still alive and going on, and maybe they had unique anatomy, or they had severe osteo-arthritis of a joint, and that can affect how these procedures can be performed. And so we can actually use those abnormalities or variations in anatomy to actually build those into our models. So there is still a lot of work that can be done to make sort of varying levels or varying degrees of difficulty in these different models. Now, again, I said that before, that the equine models are definitely challenging due to their sheer size, and we did have to get quite creative to design and construct models for this specific purpose. So if we can create these horse models, which should be the most challenging, then we should be able to create any animal model for veterinarians to learn and practice on before they move on to live clinical patients, and hopefully without the need for using cadavers. That's our goal anyways. And like I said, next steps for research, either making more challenging models would be ideal, but I really have an interest in trying to mimic blood vessels in horses and dogs, and see if we can develop or improve or train various interventional radiology procedures to help even more horses for more complex things. I'd also like to thank Equine Guelph for funding my research project, and I hope to work with them in the future. So thank you very much.